Today's injury report is being brought to you by Cape Regional Health System and Dr. Kevin McHale with Penn Orthopedics. And Cape Regional Health System is the best of both worlds for a healthier life. For an appointment, call 609-463-CAPE or visit caperegional.com/orthopedics. Dr. Kevin McHale joins us now on the boardwalk. As we've got some interesting, we teased right before the break. Doc, I got an injury here I've never heard of before, so we'll get some information on that. But I want to start with Jay Ajayi real quick with that broken back. And here we are 2 weeks later. When does that pain tolerance kind of go away to where he's not noticing that he's got any problems back there? Is that a full season type of thing, or is that like after 2-3 weeks that back pain that you talked about last week should subside?
Well, it's going to be several weeks. It probably won't be lingering all season. The one thing that's good with this injury, if there's anything good about it, is that it's pretty stable and that the fracture is going to heal on its own regardless of his activity level. So it's going to heal. It just takes time to do so. The problem is it does take several weeks. So he's going to have pretty significant pain in his back for at least the first couple weeks, but then each subsequent week it's going to get less and less. I wouldn't expect that back to be bothering him the entire season, but for the next couple of weeks, absolutely, it's going to be very, very sore. When we talk about different positions, dealing with this injury, it might be a little bit easier for someone that's not a running back taking a lot of pounding to play with this type of injury. So there's no question he's a pretty tough guy to get out there and play through it. But it should get less and less each week. Probably won't last the whole season, but definitely should be bothering him probably next month or so.
Okay, let's go to his backfield mate who missed practice again, Corey Clement. And last week we didn't really bring him up because we thought he was going to play. We just hear, and this is the question I want to ask you when we just see the injury report. Now, you worked with the New England Patriots, so you know what kind of goes into these things. When we see the injury report and it just vaguely says quad, what are some of the possible problems he could be having that would have kept him out and that he didn't practice again today?
Well, what typically happens when you see something like quad or hamstring, it's some type of muscle strain. And what we really don't know from, being just people watching them on TV and listening to the injury reports is that we don't know the severity. So it's typically a muscle strain, and it happens when they're doing this high-velocity sprinting. There's an incredible load that gets across these muscles, and it can cause kind of just an overload of the muscle, and it gets strained, and you can have some partial tearing of the muscle itself, depending on where that quad injury. Sometimes it's more of a quad tendonitis or tendinopathy issue, or it's more the muscle itself. Typically, we think of them as it's usually the muscle strain. The thing is, we don't know how mild or severe it is, and sometimes these pretty mild strains like a quad, he played Wednesday of last week. We thought he was going to be back. All of a sudden he was limited on Thursday, and then he's out. You don't know if it's that mild strain where you play through it or maybe you miss 1 or 2 weeks versus the more severe one that could take, 6 to 8 weeks to get back from. So, hopefully, obviously it doesn't seem like he's going to be playing this weekend, but hopefully it's a fairly mild one, and we see him in a couple of weeks, and it's not that he's out for any lengthy period of time.
Okay, Earl Thomas, his second broken tibia on his leg. We saw him getting carted off the field, flipping his team the bird, which would obviously indicate he thinks he's done for the year. But what's the long term? I mean, he's I don't want to say an older guy, but he's getting right around 30. His second time he's had this broken tibia. That's a pretty gruesome injury.
Yeah, so tibia fractures are definitely gruesome injuries, not something that you want to have. Incredibly painful, but typically, his first fracture actually was treated non-operatively back in 2016. So typically, these are a lot of times they require surgery. If it's completely non-displaced, I don't know what his X-rays look like, but when they're completely non-displaced, they can be treated non-op. They can heal fine, but there is a slightly added risk of a refracture, and obviously he sustained that this past weekend. So for him, he'll mostly get that fixed with a rod and screws that go down the shaft of the tibia to stabilize that fracture. Once that rod's in there, though, it gives a lot of support, and he'll be able to gradually advance his activity as he tolerates. It takes several months, though, to get back to running. I would expect him to, be not doing any football-related activities, closer to like the 6-month time point as far as getting back to really playing. But he'll be ready for training camp, whichever team he chooses. Sure doesn't seem to be Seattle at this point. But, he'll be ready. Definitely season-ending injuries now, but really shouldn't affect his overall performance in the long term once that fracture is completely healed.
All right, I never heard of this one before. Haglund's deformity, Eric Berry. This is one of those things where you just see heel in parentheses in the injury report, but a Haglund's deformity is the injury, is how they're explaining it for chief safety Eric Berry. This guy's gone through a lot. He had, I think, lymphoma last year. He missed a bunch of games, and now another injury that I'm not familiar with.
Yeah, so the Haglund's deformity, it's just simply a bony little bump on the back of your heel, okay? And that bony bump can cause actual irritation to your Achilles tendon. It's right where your Achilles tendon attaches. Now, the first thing that might set off an alarm in you is that Eric Berry, we know he tore his Achilles last year. Is this related to the surgery? Well, this happens to be, at least for all the reports, it's on his other ankle, so it's not a directly related to that surgery. But it wouldn't be surprising if maybe, getting back to rehab, maybe he's compensating for the injured side and putting a little extra load on the other side that's leading to aggravate this chronic condition. So the Haglund deformity, that little bony bump, can be asymptomatic. You just maybe wear a special kind of cleat or it gives you a little padding or a little insert in your cleat to give you some padding on the back of the heel. A lot of players can play with it for a long period of time. He actually had a little issue with it last season, but in the preseason and was fine afterwards. So it's not something that can't be rehabbed. But the problem is now, obviously, when it gets so inflamed that Achilles tendon insertion, it can be very painful and it can take sometimes a couple of months for all that inflammation to settle down and to get back to a point where he's having a little enough pain that he's able to play through it. Occasionally these need surgery, usually not, but it is possible that that's something in the future if he just doesn't get better.
Wow, that's a very interesting one to see. You learn something new every week here on the Injury Report. I know last week with the transverse fracture, we learned a lot about that. This week with the Haglund's deformity, it doesn't seem as bad as it sounds.
Yeah,
how does it get its name, by the way?
All these, it's named after some famous doctor at some point. Almost every medical condition, you can find some guy that described it and named it after himself. So it's easy as that. But the problem itself, is really just that little bony bump, and it seems like it shouldn't be an issue. But when you get really bad Achilles tendonitis and inflammation right near where that little bump is, it causes the most pain with jumping, running, and any type of activity that requires bursts of speed. So you can imagine at his position, that's exactly what his job description is. So it can be incredibly painful, and it can really limit his ability to perform. So as a result, it can take a while for that inflammation to get down, rested enough to be able to get back to those activities. Sometimes the actual treatment is if they need a surgery to cut away that bone and actually have to repair that Achilles tendon, depending on how much of it gets worn because of that irritation. So, it's a pretty big to do. It's not something they rush to unless you really can't get over this with non-operative management.
Okay, today's Injury Report brought to you by Cape Regional Health System, Dr. Kevin McHale and Penn Orthopedics. Cape Regional Health, the best of both worlds for a healthier life. For an appointment, call 609-463-CAPE or visit caperegional.com/orthopedics. Some good ones this week. Hopefully Corey Clement is back out there. And so far, the Eagles have stayed pretty healthy this year, but we've always got some new ones that we got a chance to learn about this week on the Sports Bash. Thanks, Doc.
Yep, no problem. Hopefully we get a nice little rebound win this weekend. We'll see.